Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News & World Report and are number 1 in New Jersey. K. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Monmouth Moms podcast. We are here today on this beautiful summer day in Bell Works in Homedale, New Jersey. Beautiful day. I'm enjoying August a bit more than I was July. The summer's been very strange, and June was also well, actually, I guess June was nicer, but July was we had the smoke. And then or was that even in June? I don't know. It's a blur. June. It's a blur of bad weather, basically. Yeah. I know you get those summers occasionally where it rains a lot and it's just very unpredictable, which everyone keeps saying oh, we live in Florida now. This is what it's like to live in Florida. So I don't know. But I am enjoying the weather so far, but I feel because of this strange summer, it went by even more quickly and you're trying to savor it. Mm-hmm. So I mentioned on the last podcast that I've made an executive decision for all parents out there to stop worrying so much about back to school because we're not there yet.
Agreed.
And enjoy the summer, enjoy your children, and go to the beach. If you don't like the beach, go to the pool, mm-hmm. Go hiking, go do something because before you know it, they are 19 and they don't live with you anymore. Like my son just moved out. So it goes so quickly. But I am enjoying all things summer in Monmouth County. And actually, we just put up a bucket list of fun things to do in August in Monmouth County. So check that out on the Monmouth Moms. Today, we are continuing our series with our family health care series with Hackensack Meridian Children's Health. Thank you so much to Dr. Nader Nakhleh, is a board-certified pediatric pulmonologist specializing in the care of infants, children, and teens with respiratory disorders. He's also the division chief of pediatric pulmonology. Thank you so much for joining today.
Thank you for having me.
We are discussing all things asthma today and also going to touch a little bit on allergies.
Sure.
Which I believe is your specialty. So
yeah, we see it. We see a little of that.
A little of that, yeah. Right? So my children have never had asthma. I have no experience with asthma, but lots of parents, face having their children diagnosed with asthma, and also, and maybe they themselves have developed it. So really curious to kind of delve in today and learn more about signs and symptoms to watch out for, how prevalent certain asthmas are, exercise-induced asthma. I've heard that term even when I was a child. I think one of my siblings may have been diagnosed with that. But what are the main, causes of asthma, and what can parents really look out for when they think that maybe their children might have a problem breathing?
Sure, it's a tricky question to try to explain or to get to the root of what causes asthma because it's actually an unanswered question.
Okay.
There are genetic variations that we don't fully understand yet. There's interactions between people's genetics and their environment. And there are also immune system changes over the years that have, changed how human beings sort of react to things in their environment, hence allergies. But the diagnosis of asthma is not as difficult to make. It's usually a result of repetitive episodes of wheezing and or coughing. If this were to happen, let's say on 3 or more occasions where a child wheezes excessively from being sick, let's say, or from some other interaction with a trigger, like a food allergen, or from, let's say, exposure to a pet or some sort of allergen, I always say 3 strikes, you're out. If you've wheezed and or coughed and you've been given, let's say, a medication called albuterol, which is something that you find like in an asthma inhaler. It's used also in a nebulizer machine. If your doctor's prescribed that for you, or an ER, and it's been recurring, at that point, it's fair to say your child probably has asthma and should seek further care with the pediatrician, primary care doctor, and/or specialist. The root cause of asthma itself is difficult, as I said, but the triggers for what makes a child cough a lot and/or wheeze a fair amount are pretty well defined. And you mentioned a few of them. Exercise can trigger a child to cough and go into what we call a bronchospasm, which is the thing that causes you to wheeze. Weather fluctuations, extreme temperatures, extreme heat, extreme cold. Illnesses, viruses are a top reason, especially in the little ones, the preschoolers and the toddlers. And there's, the allergen exposure, whether it be a food trigger or an environmental trigger. Those things can be tested for with allergy tests. And so we enlist the help of our local allergists numerous times for patients who need help managing that part of their asthma. But it's something that we see plenty of and are handling it with pretty effectively with medications that treat the symptoms, and also in some situations we use medications to control the asthma. Different, I guess, severity of asthma. There's mild, there's moderate to severe, but it's a big umbrella term.
Yeah, it sounds,
Defines a lot of things. So asthma, I've always been taught, what is asthma? Is asthma really a thing? It's a word that describes many things.
Interesting.
But it's at its root, it's airway spasms that cause cough and/or wheeze. That seems to repeat, not just once or twice. You probably heard of RSV, bronchiolitis. Babies can do that. They can cough and wheeze from RSV or similar infections. That doesn't mean they have asthma. That's just a one-time thing that's triggered by a virus. But when it happens repeatedly and predictably, I guess, we then go into the world of asthma and treat them for those conditions.
Okay. Are babies sometimes born with asthma? Is that, or do you develop asthma like at a certain, is there like more prevalent time where children develop it at age?
There are different schools of thought, and years ago people would say you can't diagnose asthma in kids under 2. And I disagree. Infants can have asthma. I've had 6-month-olds who cough and wheeze repeatedly, and they don't have some sort of structural heart or lung problem. They have asthma, and they tend to have strong family histories. But we tend to find the first onset of wheeze or repeated wheeze in the preschooler age, the 2, 3, 4-year-olds who are getting sick a lot, let's say in preschool, who come down with illnesses because their older siblings brought them home, and then they start to have symptoms early on. So we tend to find it early on, but there are very few babies actually born with active symptoms of asthma. You sort of start developing it once you've been triggered by something, so to speak.
Okay.
There is something called the allergic march. It's the sort of natural history of the progression of allergy and asthma, where an infant actually might present early on with eczema, which is sort of an allergic phenomenon that where the skin is dry and scaly and irritated, can be a result of, let's say, reaction to milk or milk protein, or a food allergen, let's just say. And that can sort of start to improve and then morph into recurrent wheezing, which then can morph into seasonal allergies, and then you have this sort of typical we call it a march that the people kind of predictably kind of go through.
So I never realized that. So people that are predisposed or have some type of allergy are also predisposed to having asthma. Is that like they're linked?
Yeah, there's I call them 3 musketeers: allergies, asthma, and eczema. They don't always live together, but they're frequently hanging out.
Interesting.
So if you have one, you probably have another one.
Okay.
And some people have all 3.
Okay.
Yeah.
So is asthma preventable? Does it depend on how the type of asthma you have in terms of like having an episode, I guess?
Mm-hmm. What I always tell parents is I can't make your child not have asthma, but what I can do is I can help identify what's likely to trigger it. And if a child has frequent episodes or has what we call persistent asthma, then we prescribe them medication that prevents the flare-ups by treating inflammation on a daily basis in an anti-inflammatory inhaler. So there are medicines that help reduce the number of flare-ups you have in a year, but the truth is nothing can really stop an asthma attack from happening. But once you recognize it's starting, then you have a good action plan in place, and you can stop the symptoms much quicker with the know-how.
Okay.
Yeah.
So you are a newer parent, right? And you have, your first child, and they appear to have or be struggling to breathe, right, for the first time, and you're not sure what's happening. You don't have an inhaler on hand, right? There's been no diagnosis. What do you advise? Like, just take them straight to the hospital, bring them to the doctor? Does it depend on severity of the episode?
Yeah, no, that could be a very scary situation for either a new parent or a parent of a second or even a third child to see them in distress and having trouble breathing. The majority of those first-time episodes are usually associated with an illness of some sort, like an RSV or some virus infection. The best thing to do at that point is to pick up the phone and contact your primary care doctor. There's always an on-call physician or provider you can speak to kind of help you, over the phone decide what the next steps are based on what the child is doing. What we typically tell parents when they call us for this advice is kind of count the respirations. How many times per minute does the child appear to be breathing? So sort of count it, use a stopwatch, use your phone.
There's stopwatch on phones.
Remember stopwatch? Yeah, the stopwatch app on your phone.
Yeah.
And we look at the chest wall. We look at how hard they're breathing. Are the ribs showing? Are their nostrils flaring? Are they using these accessory muscles to sort of flare out and help themselves? If they're doing those things that appear to be signs of distress, then we recommend an ER visit if it's night or a weekend, urgent care ER. Because that child, even though may end up being just fine in the long run, in the short term, you want to make sure they're under good monitoring and their oxygen levels are good. But if you have a child who's breathing at a reasonable rate and not working too hard and is drinking and, let's say, wetting diapers fairly well, not dehydrated, these symptoms can be managed over the phone or call-in medications over to the pharmacy. It doesn't always involve an ER visit, but if it's the third time a parent is calling their pediatrician with that same description, at that point we say, why don't we look into asthma? The 3 strikes you're out rule I said before.
Interesting. Okay.
It shouldn't keep happening that way.
Got it.
Yeah.
Okay. So you mentioned earlier when there's different types of asthma, right? I've heard the term many times, exercise-induced asthma. What exactly is that? Is that a diagnosis? Is that
Sure
a type
is.
of asthma?
So on the spectrum of asthma, when it comes from mild, moderate, and severe, and we see them all, exercise-induced asthma, some people feel is like one of the milder forms because it doesn't typically involve having to take a medication every day for prevention as far as a steroid inhaler, anti-inflammatory, but rather a rescue inhaler is kept on hand and utilized when the patient has symptoms or even before. So if a child or an adolescent, is known to cough or feel chest tightness when they run or play a specific sport, and it's very sort of noticeable that every time they run and do X, Y, or Z, they need their inhaler to feel better, then we tell them to pre-treat. Take 2 puffs of albuterol before you go for a run and you're just fine. Very rarely will a child who has asthma triggered by exercise require ER care or urgent care or hospitalization. It usually is very manageable with just an albuterol inhaler.
It's more like of a discomfort versus like something that's extreme.
Correct.
Okay.
I mean, the airway muscles that surround your bronchi or your bronchial tubes go into a bit of a spasm. We call it a bronchospasm, and that's what makes it hard to breathe. And then there's some wheezing and there's some coughing and there's some difficulty that ensues, and the albuterol inhaler stops that right away. It works quickly. So you could take it as a rescue once you feel something, or you could take it beforehand before you go for a run if you know what's going to happen.
I see.
But that's one subset of asthma. It's just sort of and it's pretty fairly easily diagnosed with just history. Take a good history and find out that the child only does it when they run, or play this sport or that sport. Then you have that diagnosis.
Okay. Is there a main type of asthma that is mostly diagnosed, or is it kind of all over the place in
I
terms
think the
of?
most common type is when it comes to the age groups, the toddlers and preschoolers and kindergartners, that's viral-induced wheezing, illness triggered. Once you get a little older into like the elementary school and teens, it's allergy-induced asthma.
Okay.
So those two are very common.
Right.
I mean, in the state of New Jersey, you have 160 some odd thousand kids with asthma. In Monmouth County, it's something like 10,000, which is roughly I think it's like something like 7% of kids in Monmouth County have asthma.
Wow.
So it's a fairly common thing. It can get, I always say it can be underdiagnosed and it can be overdiagnosed because there are things that aren't asthma. So if a child is complaining, bring it to attention to the physician or provider and see if it requires further management.
Are there symptoms that maybe wouldn't typically be like if you're not seeing wheezing, but maybe you're having trouble getting a full breath? Is that something that's like maybe
Right.
undiagnosed asthmatic person?
Yes, those are the trickier ones. The ones that don't wheeze make our life more difficult because
Interesting.
wheezing is kind of an easy tip off, right? It's a pretty classic symptom, easy for a parent to describe. That out exhaling whistle that occurs. But there is also just chest tightness, which is kind of vague, but some kids feel that. And some kids will just cough.
Okay.
It's called cough fairy in asthma. They just cough and cough and cough, and nothing stops it until you take an inhaler or do a treatment. So those are more difficult to diagnose, but not difficult once you gather the full history and run some lung function testing. If they're old enough to do it, these are all things that help us, diagnose things when they're not so straightforward.
Okay.
Yeah.
If your child is having an asthma attack, and like I said, this is kind of undiagnosed, and you don't know what to do. Is there something? Does it make it better if they go out in the cold air or in a steamy shower? Like I know that those are some things that if you have croup, you tell patients to do sometimes. Is there anything else to like help them kind of?
Yeah, I think what helps is humidity is helpful, right? So if you have like a humidifier, the steam shower, it is soothing. It slows down your respirations. It kind of minimizes the stress and anxiety of having some difficulty breathing. But many times nothing will really stop an asthma, let's say, attack or an episode unless you have some medication on hand. And that's why the urgent care or the ER is the right place to go if it's persistent. The cold air does seem to help, little ones who are experiencing croup, which is a little different from asthma, but it's an illness that triggers difficulty breathing and a very distinct type seal barking cough.
Right.
And the cold air does nothing more than constrict the blood vessels and decrease the swelling that's occurring up in the voice box.
Interesting.
And so that's why going out in the cold in the wintertime can make a kid who's crouping sound better and just breathe easier.
Okay.
But won't necessarily help an asthmatic. In fact, extreme cold temperatures can actually trigger a bronchospasm. So we don't recommend folks who are having asthma symptoms go out in the cold, but if there was access to humidifier and nothing else, that's one place to start.
Okay.
Yeah.
So in extreme cases of asthma, what does that look like for a patient every day? Like, are they having attacks every day? Is it like really hard to manage and get under control? What does that look like for some of your patients?
Yeah, for some of our most severe patients who report symptoms, before going on therapy, let's say, if we're meeting them for the very first time and we try to take a history, what most severe asthmatics will describe are symptoms that are occurring almost daily. Not severe symptoms, just a cough or chest tightness, having to reach for their inhaler. If they're taking their medication fairly regularly, having urgent care visits or ER visits like twice a year or more, requiring, let's say, a shot of steroids or a dose of steroids, having difficulty at night. Nighttime seems to be the one time of the day where coughing and wheezing will occur more frequently in asthma. So twice a month or more, they're up coughing, and all these symptoms sort of help categorize their asthma as mild, moderate, or severe. So when you fall into a severe category, we have to sort of chase after that severity with a different, let's say, cocktail of medications. The inhalers that we use are extremely safe, low dose, and avoid patients from having to go on those big gun steroids, so to speak. And so we tailor each patient's asthma severity to their dose of medication that we prescribe. And in some situations where the patient is on a regimen that's appropriate for an asthmatic who's severe, we have other tricks up our sleeve, so to speak, and there are medications that are in injectable format that are given every few weeks or let's say every month. You've probably seen commercials for these things. They're called biologics. We won't name names, but there are definitely medications that we reserve for the severe patients that really help, that are non-steroid, but also reduce inflammation.
Okay.
Yeah.
You mentioned food allergens and there being a link to asthma or to triggering asthma attacks. Is it only food or is it airborne as well? Is it depending on the case?
Yeah. A, B, and C, all of them. I mean, there is a fair amount of data on allergen-triggered asthma, and the honest truth is we don't know until either you test them or they try different foods. Foods can trigger asthma flare-ups. Most commonly, the the dairy products, meaning eggs and milk, nuts, shellfish. These are your common triggers. Sometimes soy, but we find that they'll trigger eczema first in the young ones, and sometimes if it persists, it may trigger the asthma as they get older. So you'll hear about peanut allergen being a food and airborne, in a sense, if you're very sensitive. But pet dander, dust, trees, grasses, molds, ragweeds are your so-called environmental triggers. So we'll always take a very detailed history of like what's in the home, who smokes, who vapes, do you have pets?
Vaping can cause allergies too.
It's an irritant like any other.
Oh, interesting.
Yeah.
Huh.
So there are a lot of things that we need to take a history from a parent and from a child is, how many stuffed animals do you have in your bed, right? So how much dust is there? And it's not a matter of, cleanliness. We never question people's cleanliness, but it's a matter of, what is the child around and how can we minimize that? Do we have to recommend an air purifier? Do we have to recommend maybe having the pet not be in the room so much? So I hate to do that to people unless I know they're allergic. So that's where we have our allergists help us with some testing.
Okay.
Yeah.
That's so interesting. Can you outgrow asthma? Is that the right term
Yeah.
to even use? If you
You can't. Here's what I tell parents, because this is the truth. I never like to lie to people. You can outgrow your need for medicine. You're probably not going to outgrow your body's tendency to have asthma. In other words, it sounds like a weird answer, but what I'm trying to say is, I have patients who hit a certain age, stop coughing, stop wheezing, stop needing medications, and don't need to come back to us anymore. At whatever age, let's just say 9 or 10. It doesn't mean their asthma's gone. I always tell them, look, you can hold off on coming back to see me, but there's a decent chance, like when you're off in college, you may start noticing a lot of sniffling, sneezing, itchy, watery eyes. You might even cough or wheeze when you're older. It can come back.
Okay.
And that's that allergic march I was talking about. It starts off one way, it morphs into something else, maybe goes away for a while, and you have a little bit of a honeymoon or a break from it. You haven't outgrown it, but you can celebrate that you're not requiring medicines for a while. So you can outgrow the need for medicine, but not having the actual, the genetic makeup you have is what you have,
Okay.
right? So that's kind of what I try to tell people is don't think this can't come back again. I hope it doesn't, right? But it can.
I have a, I don't know, they call it like a fainting disorder, so to speak, a vasovagal syncope. And when I was like in middle school, it happened all the time. I would, if any like stress related on my body, if I hit my elbow, like I hit my funny bone in wood shop, and I woke up like on the floor, and all these different things kept happening. And they kept happening over and over. So I was diagnosed and put on all kinds of medication, like a salt tab or whatever. And but then I outgrew. They said like I outgrew it, right? So I thought that I would just never have it again, and I thought it was like something that happened like when I was younger, and now I'm like cured. But then I guess like 2 years ago, I woke up. I was 37 at the time, and I woke up with like a weird like pain in my stomach, and the next thing I knew, I was like going down on the floor. So there, I went to the doctor, and he said, I don't really like the term outgrowing something, because it's not so much that you don't have it anymore. It's just that maybe your body changed, or maybe you figured out how to cope with it differently, but it's still like possible for you to pass out.
Exactly. It's the same phenomenon.
Right.
These things can go away for a while, not bother you for a while, but they can come back. And as long as you're aware, then you don't feel so surprised when it happens.
Okay. Is it stress related too? Can like you be can it be triggered more intensely when you're going through something that's difficult?
Yeah, something very intense, I would say. So one other thing, and I'm glad you mentioned it, one other trigger besides illnesses and allergies and temperature, emotion fluctuation. So some patients will report, and this is pretty well documented, when they're like being tickled and they're laughing for many, many minutes in a row, they can start to go into a coughing fit. If they're crying a lot. So strong emotion can trigger a bronchospasm, which is the coughing, the wheezing, the chest tightness. So we don't tell parents don't laugh, don't make them laugh, or don't make them cry, because that's not good treatment plan. But it's also one of those triggers that we always list, like know your triggers.
Like a roller coaster or something that.
No, that probably wouldn't do it,
No.
unless you spent like a long time screaming, because yelling
Gotcha.
and screaming can do it, or shouting. But no, just the actual stress of going through an episode like of a roller coaster wouldn't do it, but if one were to laugh a lot or cry, it has to do with, I guess, with the actual use of the respiratory system repeatedly. It's akin to exercise. I mean, not that laughing is exercise, but it's a similar idea.
Okay.
Overuse of the lungs rapidly.
What about hormones? Like for women, like do they notice that like if their hormones are fluctuating each month, that like does it trigger that at all or not really?
There is an association between menstrual cycles and asthma, as far as I know. There is a lot of moms who report during pregnancy, however, that they began noticing their asthma is back if they had asthma when they were younger. And there are patients or parents who report during pregnancy that they suddenly developed asthma they didn't know they had. They never had before, so the so-called adult onset. So pregnancy can do that, and that has everything to do with the fact that there's only so much room you have in your torso between your neck and your pelvis, and as you have if you have a growing fetus, taking up space, the lungs get a little squished, if you will, and so that they have to sort of compensate, and sometimes the patient can present with asthma symptoms. But,
interesting.
That's the closest thing I could think of that's like hormonal, let's say, triggered, because there is obviously some component there during pregnancy.
Okay.
Yeah.
For parents, I'm sure you treat, many children who, if, they are diagnosed with asthma and it's maybe more on the severe side, I'm sure it's, it's a lot to manage for a child, and also for the parents can be stressful. What are some of the things that you tell your patients and the parents to be mindful of each day, and also, to kind of also make them feel a little bit better too about having to, be cognizant of this new diagnosis, right, for their child that they faced with each day?
So it's like any other chronic condition. It's important to explain to the child that this is normal for them to have this. This is not something that makes them unusual or strange. And because, as I mentioned the numbers before, because it's so common, I don't think it scares too many kids to hear about it, or parents, because this is not an unusual diagnosis. But it's different. When they get diagnosed for the very first time, it's not old for them. This is new for them. And so we understand that. And so what we do is we make sure that they have an asthma treatment plan filled out, completed, signed and stamped by the provider and by the parent, because this basically lays out the medications you would use either daily if you have one, or in case of symptoms, and the copy is given to the parent and is given to the school nurse if they're in school, or any caretaker. This way it's crystal clear what to do if this child begins to have symptoms. There's no mystery, because it's the unknown that scares people. And if they were to start having symptoms and didn't know where their inhaler was, didn't know what it was to have asthma, or weren't given some clear direction, then they're going to be left out in the dark. So it's all about just making it clear what to do in case of a problem, and to sort of normalize it in a sense that this is okay. We don't know why you have asthma. We think we have some ideas, but here's what it is, and we're going to treat it.
And so actually, I forgot to ask this earlier. Your primary maybe recommends that you go to see a pulmonologist to decipher whether or not you do have asthma. Are there tests done to diagnose it? How does it work?
Yeah. So before they invented lung function, testing equipment, it was always about the three strikes you're out story, the repeated symptoms. So you could do it, meaning make a diagnosis with just a history gathering, session. But technology is very important, and so we like to sort of use our technology and optimize our diagnostic capabilities. And we do lung function testing. It's essentially a breathing maneuver into a device that's hooked up to a program on a laptop. And what we do is we measure lung capacity and airflow rates. And there are very clear numbers and criteria for what is considered asthmatic versus not.
Okay.
And so we do that in the office. We also measure a gas called nitric oxide that someone can exhale into a device. We can measure that gas. That's also known to be elevated in kids. It's a biomarker for asthma or allergy, at least. And then there's more extensive equipment, more detailed tests that we can order over at Jersey Shore at the hospital. We have a PFT lab, a pulmonary function testing lab there, for even more detailed testing. But office equipment is the first stop when you're in there being seen, and it should be also known that patients above the age of 5 can do this. Under the age of 5, not that there are not intelligent 4-year-olds and 3-year-olds, but it's a maneuver that involves a very specific technique, and so we reserve it for kids over 5. Under 5, we have to go by the history and the exam and what parents tell us, and not rely on equipment and numbers just yet.
I see. So do you always recommend that they also see an allergist?
Yeah, if the patient has pretty clear-cut allergy symptoms and wants to know their triggers, we offer them one of two things: a visit with our local allergist teams. We have referral addresses, phone numbers that we give them all the time, and find someone close to home that they prefer. But there are also blood tests that we can order.
Okay.
As a starting point, you can measure how many antibodies you have, specific antibodies to dog, cat, chicken,
Wow.
trees, grass. There's lots of things you can test for that are measurable on a blood test to see how much allergy you have or how allergic you are to those things. It's a pretty, extensive panel. And it leaves it up to the parents. If the parent wants to start with a blood test and then decide whether from there they should see an allergist because the tests don't seem too concerning, then we don't refer yet. But I'm always open to the idea of incorporating more eyes and ears to help figure things out for parents.
Got it.
Yeah, and especially if a patient needs to be on allergy shots, that we rely on our allergists for. We don't give them in our office. So if a patient's highly allergic to, let's say, environmental triggers, pets, and they have pets, they don't want to get rid of them, allergy shots are an option. So we refer to those colleagues of ours for help.
Okay.
Yeah.
Great. This has been such helpful information. I'm sure there's lots of parents out there that, maybe are struggling with, not sure what's wrong with their child, or also are just kind of used to this, and it's, just valuable information for so many. Where can parents find you to make an appointment, to get some more information?
Speaking of technology, there's the website is hackensackmeridianhealth.org. And
we'll link it too here.
Of course,
Yep.
if you can link it over, that would be great. Our office phone number is 732-776-4268. You can call and make an appointment anytime.
Right, near the Jersey Shore Hospital, right?
At Jersey Shore University Medical
Yeah,
Center.
yeah.
We're in Neptune, New Jersey, on Davis Avenue, yes.
Perfect. Yeah, I've been there for the towers. They're the
Hope Tower.
Hope Tower, yeah.
Yes,
Beautiful
exactly right.
building. My
Yes.
daughter went to an endocrinologist there, and it's a really, really impressive building. Really
It's
nice.
a very nice facility. They
Yes.
built it not too long ago, and we're happy to be there. So it's a sort of one big happy family all on the 5th floor.
Oh, perfect.
Yeah.
I think she's on the 6th, I wanted to say, but maybe I'm wrong. I don't know. It's been a little while. It's good we haven't been back, right?
Yeah. That's
Good
always
you
good.
haven't seen us.
That's always good.
Well, thank you again. And like I said, we'll link everything here to access all that information and find out more. Thanks again to Hackensack Meridian Children's Health for sponsoring the Family Healthcare Series with the Monmouth Moms. Coming up, we have we just announced our next event for the fall, our Monmouth Moms Fall Festival, coming on Sunday, October 22nd here at Bell Works. We have lots of vendors, over 100 vendors. Shop a little bit early for Christmas. It's a week before Halloween, so like November 1st is automatically the holidays now. So we'll have lots of good stuff there. We also have our Touch-a-Truck activities happening outside that day. Lots of kids activities. We have new trucks. We have a video game truck, all kinds of cool stuff for the kids that day. We have a pumpkin carving contest. That's something new that we haven't done. So anyone out there who wants to show off their skills and compete, we have some cool prizes, and it'll be fun. We have some kids voting for who wins the best pumpkin that day also.
Very cool.
Indoor activity zone, food, Barbella will be open. So it's a great community day. Definitely mark your calendars for that. As always, we have lots of local events and activities happening as we near the end of summer, unfortunately, but go into fall. Fall's also so much fun. So lots of fun stuff happening. As always, visit themonmouthmoms.com for more information and where to go and what to see as we head into the next season. Have a great day, everyone.